hopefully technology will collaborate. Please go ahead.
Alex, would you please put up my slides?
Yes, they are loading right now, so just give me a couple seconds. Let me fix you. There we go. And if you can just ask me to forward slides, I will do that whenever you say next slide.
All right. Sure. Thanks, everyone. And I think that this morning has been a confluence of catastrophes. I lost internet, and then we could not share the screen. But as a statistician, never gives up. If you cannot track the real problem, you are actually going to do a first-order approximation, second-order approximation, and try to get to the truth. So I just wanted to share some of the work that I have been doing, actually really entrenched in this work for the last 7 months, but this is not just my work. Next slide. Is actually, we formed a study group in March. And I still remember this was the first day of the stay-at-home order at Michigan. And we were very worried about the virus situation.
I think we are having again some technical problems because I lost audio and I see a few people have lost the audio too.
Yeah, I think her mic has stopped working. I'm not sure what's going on. She's certainly welcome to call me or email me if she wants to try to work through this.
Okay, let's just wait for 1 minute, see if we can fix the issue, and if not, we'll might have to end our symposium early. We'll see how it goes.
I guess we have to go to the third order approximation now.
That's what it looks like. I guess this is the downside of virtual conferences. There are some big advantages, but also some big disadvantages.
Right.
Let's wait for 2 minutes and see if she comes back.
Yeah.
Hey, Fabio, while we wait, I'm happy to answer questions that folks may have if there are any out there.
Actually, I do have. Oh, I think I heard something for a moment.
No, maybe it's just me because I was going to ask a question to Franz.
Yeah, I'm all yours, Vijay.
So the quick question that I had was, so you had mentioned about $5,000 research credit. So do we get access to HPCC or what kind of credit? How do we use them?
Oh, that's a great question. So when you click on this link or on the links that I will share with you, and you explore the Google Research Credit type options, you'll see a list of kind of research programs that we currently have out there, and then the application process to be able to get access to those dollars. Very similar to a grant study, right? So you're going to answer what your body of work is, what your control and test conditions are, how you're going to leverage tools across your universe, right, to be able to evaluate this. But it also is open enough where you don't feel like you have to use Google tools. You don't, but we do encourage you to use components from our side and other tools in the market to help with accelerating your discoveries. So very easy to apply for. And another area that we can go after, and I'll connect you with my education peers. They can help you through how Google can participate in some of your grant applications, and how we can support some of your claims in the grant, or come in with Google messaging around how you'll be able to leverage Google tools to accelerate that grant process, and connect you also with like-minded, call it systems, or even individuals who are parts of that overall grant program to help accelerate your chances for a win.
Yeah.
Franz, I also have a quick question for you. I'm curious about how is the expertise of the teams that work on these, high-level pipelines that clearly are connecting. It's the biology, it's the computer science, it's the data science, it's everything. How is the data expertise spread around?
Fabi, I love that question. So, locally in market, you have individuals like myself and like Naresh. So we're really generalists, right? And from a generalist perspective, we help you navigate through the tens of thousands of resources internal here at Google that are available to you. So we have dedicated research teams in specific disciplines, whether those disciplines are around, DICOM image management, molecular biology, and these individuals are typically your seasoned individuals, PhDs, professors. In fact, I met an individual the other day on a program that I'm working on. A triple PhD candidate has a PhD in game theory, a PhD in advanced mathematics, and a PhD in astrophysics. So really interesting in terms of the lens of the resources that we can bring to bear. But again, a lot of it probably also depends on the problem that you're trying to solve. So part of what we like to do here locally, or my peers out there in the various markets, is really kind of sit down with you and define what the challenge is, right? What's that business problem you're trying to solve? Nothing is off the table, right? Make it as complex or as difficult as you can. And if it's an industry-wide type problem or a global type epidemic, like a COVID-19, I can bring in peers of mine into the conversation to help refine, right, that approach with what you're looking for. Again, the intent is to fail fast. So we like to measure the implementation and the use of technology in days versus weeks and months, right? So if we can't really help you result in days, then something's wrong, and we need to kind of quickly reset and get into that, how do we measure in days perspective.
That's very interesting. So do you think the time for the very specialized graduate level programs, like you get a PhD in evolutionary biology, you get a PhD in astrophysics and so on, do you think that time is changing and it's time to actually get sort of a more inclusive education that is crossing multiple fields?
No, that's a good question. In my opinion, and Naresh, I don't know if you have one as well, is not necessarily. And I'll say that this way. A lot of the folks that I work with, have their PhDs in very specific areas of expertise, right? So when let me pick on an area. I'll pick on medical imaging, right? So medical imaging is super difficult. And the individuals that I work on, they're all PhDs or PhD candidates, but their specialty is around DICOM medical imaging management or imaging management in general, right? In fact, one of the expertise individuals that I'm thinking of right now that I'm picking on is his particular focus, and has been for the last decade, is around the use of the semi-cyclogan image technique or image theory, right? And from a semi-cyclogan perspective, his very narrow focus and his very narrow technique gave us the ability to really do two things. One, really understand how we can fully map an image of a fly's brain, which is very, very, very difficult to do, leveraging 2D and 3D CAT scan images, and about 40 nanometer type slices of that fly's brain. But two, really create a machine learning model where we can draw out the connectomes of that fly's brain, right? So the specialty of certain education still do matter, but it also helps with really uncovering that detail in the machine learning model to make that ML model effective.
Absolutely, Franz. And just to add on top of what Franz said, obviously knowledge of the business domain viruses and the proteins and everything is required. But then the technology part, like AutoML, pipeline creation, these are some of the skill sets which are not really expected to have been possessed by a person who has done PhD in biophysics or biochemistry, right? So what we are really doing here is we have tools and technologies which we have made available and easier for people to utilize, having those knowledge in a particular area of expertise.
Yeah, and Dr. Mukherjee is back with us. If we want to try to jump back through, I'll leave that up to you guys.
Yeah, just the last comment on what Naresh is saying. So those very specialized, individuals who have that deep education level, what I'm now beginning to see out there with other researchers we're having similar conversations with is, yeah, they're deep expertise in their environment, but they also have, some language expertise on top of it as well. Python, R, and other languages that they're able to apply on top of their bodies of work.
Thank you. Thank you for this perspective. I think it's very useful, especially for the students that are in the that are following the symposium right now. Okay, let's try one more time. Let's see if this time it works. Bhramar, I will only ask you to just try to please be considerate of the time, since obviously we're running a little bit late now with all these technical issues. But let's try to see if we can give another shot at your talk.
Yeah, and I think this is the last try. I do not know what is happening with my internet as well. This morning it seems to be behaving really badly, and I apologize. Never happened in all of these 7 months. Can you hear me okay?
Yes, we can.
Okay, so the next slide, please. So when we started in India, today I'm going to talk a little bit about the pre-lockdown, what happened in India, what we did post-lockdown, and how we keep updating our app in terms of our projection. So that's the main part of the story, that building a model or writing a paper is not enough. For these long pandemics, you have to find out automated ways in which you can update your models every day. And if I have time, which I'm sure I'll not, then I'll try to go from numerical analysis to talking about some strategic vision and some humanitarian aspect of this pandemic as well. Next slide, please. So if you are interested in our work, it was a very non-standard mode of communication. We started writing articles in March in Medium. And Medium is a sort of media that I have never used before. And we wrote an article on March, so we started this study on March 16th. And within 72 hours, none of us actually ate or drank or just be on Zoom calls, produced this article, which came out in Medium in March 20th, which with a longer version of the report on our center's website. And that really was quoted as a critical piece of evidence to guide India's national lockdown policies. So if you're interested, that's the link of int19.org, where you can see all our products. And then we kept writing Medium articles because we could not really wait for the papers to come out, because the need of the moment was so immediate and so urgent. Can we go to the next slide, please? So the paper came out in a special issue of Harvard Data Science Review. For those of you who are interested in data science and COVID-19, I strongly recommend this issue. Beautiful papers on several aspects of data science, which has been touched upon in today's session as well. So now, okay, next slide. When we started, India had only 536 cases and 11 deaths, and people were not paying much attention to the progress of the pandemic, but we had seen what had happened in Italy, what had happened in the US, so we did not want to wait and started this modeling. And next slide. So what we did, and we were very worried about India because though India, it's a younger population than the Western countries that have been hard hit by this pandemic, it also, the younger population has comorbidities that have been associated with COVID-19, as well as the healthcare system is very fragile. Number of beds, number of ventilators, number of oxygen, the amount of oxygen available is very limited, as well as large number of people without any health insurance or access to care. Next slide. So when we predicted, it was, again, this seems like so long ago because the 6 months have been so long. When we predicted in March, we said that yes, we are seeing 536 cases, but you can see that we plotted this data, shows the projections for India versus US and Italy, and we said that within May, we could end up in about 100,000 cases. And the 100,000 cases was actually a large estimate. At that point, the confidence intervals were quite wide as well. Next slide. And we woke up, and then the Medium article had made tremendous impact and made it to all big Indian newspapers. And you can see Hindustan Times, and they picked up these numbers that 97,000 to 1.3 million COVID-19 infections by mid-May shows projection. And me and my collaborator, Debashri, we were all over the Indian media, and it was very scary because, when your statistics is guiding policy and influencing many, many lives, it is exciting, but it's also scary because you worry whether you made mistakes. And, lockdown is not just public health, it also involves people's lives, livelihoods. So it was a very turbulent time for our group. Next slide, please. And so, since this we published this article on March 20th, and on March 24th evening, Prime Minister Narendra Modi announced India's lockdown. And we can debate whether the lockdown was effective and what is the implications of the lockdown. But I have to say that this has been since then, and there are lots of interesting things about the lockdown. And one particular thing I'd like to mention, that lockdowns are supposed to give you a static snapshot of the population, but the movement of the migrant workers started, which backfired and led the spread of the disease from the western and the northern part of India to eastern and southern part of India. But lockdown also tried to galvanize the society. We saw the celebration of lighting lamps to get rid of darkness across India. So it was a very turbulent time and a very special time like every other country. So since then, I think that the work and the model has had tremendous impact, generating 700 media clips with a reach of 4 billion people. And so this has been incredible because, I have written many papers, but I do not think that that single Medium article and the consequence of that, the impact of that is quite unparalleled. And then next slide. So what the questions, the numerical questions that were posed, that what do we expect to see post-lockdown, and when are we going to see decline in number of deaths, and what does a successful lockdown look like? And then exit strategies too. Next slide. And so we compared, so India's virus curve has been very, very different compared to other countries. So this is China. You introduce the lockdown and you see that the decline in the number of cases. Next slide. The next one is South Korea, which has done an incredible job without any lockdown, just intensive testing and contact tracing. And you can see that there was a curve and a peak and it came down, but they have maintained at a slow percentage because the number of cases are limited, so the contact tracing approaches actually worked here. And this was a very data-driven approach in South Korea as well. So next one. In Italy waited to impose the lockdown, and as a result, you see the red bars are sort of the fatalities, and still the virus curve came down after a strict lockdown was enforced. But India, the next slide, is actually, even after 6 months of lockdown, the virus curve kept going up and up and up. So you have to think about that, whether the lockdown was successful in India, whether it's possible to implement lockdown in a country like India, which is so populous, so congested. Is it possible to do isolation? Is it possible to do centralized quarantine? And I'm going to comment a little bit on that. Next slide. So there were many models, many forecasting models, and we recently wrote a paper comparing all of these models, but at the time our focus was not on the models at all. We were simply trying to get the message out that what could the situation look like? How many active cases can you anticipate? How many beds should you prepare for? So that was completely a policy driving work without thinking about papers and some of these academic comparisons. But our model, next slide, I'd like to give you a sense of what we did, and this was actually a model that was developed by my colleague Peter Song and his student to model the pandemic in Wuhan. And it's a compartmental model where you have arrows from the susceptible, infected, and removed compartments. And the interesting thing about this model is that we build a latent hierarchy compared to traditional models. And you can model these transmissions using the count data that are reported daily from the Ministry of Health. And the question is that the true proportions of people at any time point T in these compartments are unknown. Next slide. So what we sort of thought is that we are going to take the observed counts, which are denoted as Y's in this graph, but then build like a latent SIR model where the true proportions in each of these compartments are actually latent variables. And we are going to assume that you don't get to observe all of it, so that you can take care of the underreporting. And what you observe, there is a lot beneath that tip of the iceberg, that phenomenon in our model. Next slide. So our package was already there for Bayesian estimation, and you can see that here you can see that the eSIR model or the extended SIR model, the compartments of the latent variables are related from one compartment to another through some transmission parameters, and we actually approached the problem from a Bayesian paradigm and put forward structures to the priors and these latent parameters in a beta-Dirichlet manner. And then the parameters of this different system of differential equations guiding the movement of this compartment also gives you the basic reproduction number that you see quoted in the literature and in the media all the time. So you can get the direct posterior distribution of this quantity. So next slide. So then we actually assumed priors based on historical data that we had seen in Wuhan and other places in terms of the ascertainment rate, in terms of the transmission rate, in terms of the death rate that we have. And then we gradually updated it as more data from India came out. Next slide. And the MCMC I will just mention that this is one thing that we learned, that for this nonlinear compartment models, the Markov chain Monte Carlo is very complicated, and it takes a long time to actually run and converge. So we are very fortunate that University of Michigan gave us infinite computing power to actually access to storage and really a very generous gesture so that we could run these models for India and for all of its states every night for the last 190 days. Next slide. And so as in a Bayesian estimation, once you set up the compartmental model and put the priors, we can get trace plots and the posterior distribution. And the advantage of the Bayesian model is that if you are interested in anything, for example, active number of cases and so on, you can actually get that as a byproduct because you're getting the exact posterior draws. Next slide. So from this model, we actually have a visualization tool that we can get the count estimates that how many people are going to be infected and can do projections as well. Next slide. But the interest was actually what will happen if actually in India there were interventions. So in order to model the effect of the intervention, we introduced this new parameter called pi of t in this model, where it shows that if you actually, so when you are moving from susceptible to infection compartment, all of these interventions that you're introducing, the public health interventions, are reducing the probability that a susceptible person is going to meet an infection person. So social distancing, it is reducing the chance of transmission of the virus. So how do you build that in? So we introduced a parameter pi of t, and we assume that, okay, if you were actually wearing masks, then this probability of getting infected is going to go down by, say, 20%. If you're practicing social distancing, it's going to go down by 30%. So these were conjectural values that we estimated and guessed about the interventions, and then that led us to come up with different scenarios, what will happen to India under different forecasting scenarios and different intervention scenarios. Next slide. So in this graph, you can see 4 different scenarios. This is sort of like a statistician's conjured up world in terms of computer, a model of what can happen in reality. And you can see that we modeled several different kinds of intervention. If you just did not do a lockdown, if you just did a social distancing and travel ban, how do you return from lockdown? Do you have a moderate return and a cautious return? And under every scenario, what we are seeing in the y-axis is the projection. How many cases are you going to have, daily cases and cumulative number of cases, so that you can anticipate the healthcare needs as well. The next slide. We also compared what is the optimal duration of the lockdown. Was the initial 21-day enough? And we saw that 21 or 28 days were not enough. We needed to extend it to 48, 6 to 8 weeks seemed like was a doable range, and it ended up in a 6-week lockdown in India. With several unlocked phases as well. Next slide. But what was the main interesting takeaway as we were building these models and staring at these projections every day is the need to calibrate these models every day. So next slide. When we use the data from April 1 up to April 7 to April 14th, if we constantly calibrate the model, we saw that we get much better prediction, so we realized that we cannot stop. This is not another academic project where you do the model and you stop and you revisit this 6 months later when your revision for the paper comes back. We cannot take that approach. So that led to the app, which has sort of become, next slide, has become the go-to destination for many people, particularly epidemiologists and journalists, where we update our model projections every day. So we consider this as our contribution and service as public health data scientists to this in the middle of this defining crisis of our generation. Next slide. So this phase 2, so after the initial work was done, everybody started asking us that when can we expect the peak in India? And why aren't we seeing the peak in India? Why does the virus curve keep going and going up? And so then we try to understand what is the spatial level variation in terms of these models. And what we did was the next work was in collaboration with Dipankar Basu, who is an economist from Amherst, UMass Amherst. And so we wrote the second paper, next slide, which characterizes why this happens. What happened was that India is so heterogeneous, and you have various different states. And in this slide, you can see that the virus curve in India and then some of the virus curves in the states. In some of the states, for example, Delhi, you can see that the peak has been it went up and went down. You see sort of the same types of behavior that you see in other places, but not in India. And the reason is that different states are coming to the boiling point at different times, and this national data is sort of a confluence of different state-level data, so it's very hard to see the national peak in India when this cascade of peaks happened, and so basically you see Maharashtra and Delhi first reaching the high number of cases, and then the virus moved to the eastern part, and so for the peak to be visible, all the states had to come to a state of containment. And so, next slide. So basically, let us look at Delhi, and we also realized that the importance of updating these things. Delhi in June looked terrible, and the projections were dire. Next slide. But Delhi in August looked much better. So you can see that the need for dynamically really updating these models and these apps, because the reality on the ground changes very fast. Next slide. So Phase 3 was more methodological. Phase 3 was much more like an academic endeavor sometime in July, around July 20, one of my friends called me and said that, there was an article in New York Times which mentioned your name. And I saw, and the title of the article was "How to Identify Flawed Research Before It Becomes Dangerous." And it was an article by Michael Eisen and Rob Tibshirani from Berkeley and Stanford, sort of trying to caution people about the danger of these preprints and these Medium articles guiding policy. And before I read that, I looked at the title and I said, "Oh, my career is done." But actually, this will probably remain the highest honor in my career, is that the article said that the work that we did was nimble and rigorous in communicating data projections to influence policies. So that was a sigh of relief. Next slide. And what can you want as data scientists? But then, I have had a very exciting time. I have learned how to be on television, how to be on media. This was my interview with Karan Thapar, which is sort of the Anderson Cooper of India, for his very independent pursuit of truth and facts. And at that interview, he really pushed me to ask questions that I was not very comfortable with. So next slide. And it was about the notion of how these projections actually match with serosurveys. And so that led to a very interesting ideas of how to adjust for misclassification and sampling bias in modeling this data. Of course, the tests are being offered in a prioritized manner. We all know that it is symptomatic testing. There is tons and tons of asymptomatic people, as well as the tests are not perfect because they have a high level of false negatives. How do you actually grapple with that misclassification and sampling bias in these tests and reconcile with the evidence that is coming out from population-based serological surveys? Next slide. So at the time, 2 students from ISI, Indian Statistical Institute, were doing a summer internship with me, and together we actually developed an extension of the eSIR model called eSIR Fancy standing for false negatives and symptom-dependent testing, where we estimated that for cases, the underreporting factor in India is about 20 to 25, and for deaths, it's 5 to 8. That created a lot of headline because we said that, yes, you are seeing 5 million cases, but there are truly 100 million cases. And lo and behold, the latest serosurvey from India actually shows that about 7.1% of India is infected, and that gives us right at the 95 to 100 million cases. So this was a great example where we did not know the serosurvey data, but we estimated this underreporting through models, and then the serosurvey came out and said, yes, we were right in the ballpark. So there's a lot of real-life validation with data science for which I'll remember this project for the rest of my life. So if you have so many cases, the good news for India is that the infection fatality rate then is very low, because lots and lots of people are experiencing the virus without getting sick, without ever having to go to the hospital. So, so now, if you lift up all the public health prevention and don't take any precaution, then you can say, I'll pursue herd immunity. And with even 0.1% infection fatality rate in India, if you let 50% of India get infected, then you are going to see 670,000 deaths. And I'd like to say that maybe this is a price that a country like India is willing to pay, but every death is the face of a loved one, and every death is preventable. At least some of them are. So the next slide. So the next part, actually, it was much more academic, and we submitted these papers to statistical journals where we have these extensions, but we, in parallel, always try to write the Medium articles and get the message out to the public, so, and in a non-technical manner. Next slide. So where is India now? So India today, as of yesterday, 6 million total cases, about 1 million active cases, 100,000 deaths. 75 million tests have been done. Over the last few days, the virus curve has been encouraging to the point that I actually bought my ticket to go back to India. The case fatality rate in India has been low, and the infection fatality rate even smaller if we believe this unreported asymptomatic cases. Can we go to the next slide, please? And so as you can see, this is the latest curve. I'm showing you data fresh from our app downloaded yesterday. And the curve has turned a corner in the last few days. So that's reassuring. And most of the states actually show a steady decline. Next slide. And if you look at the countries which have actually had millions of cases, US leading the charts, of course, you can see how quickly this virus accelerates. So then in this figure, I have plotted how many days it takes you to get to the million. And so you can see in India, the next million came much quicker. Like, you know, the 2 to 3 million was 16 days, and then 3 to 4 million was 13 days and 11 days and so on. But then now the virus is slowing down. As you can see, the next number of days it takes to get to the next million, it's slowing down. But it is just like a million cases every 10 days. That's what India was looking like for a long time, and it was causing us a lot of concern. The next slide. So I'll just skip this slide because, you know, it shows the case distribution in India to prove my point that initially there were some main contributors to the cases, and this was mostly from the north and the west. The initial cases were all imported, and then it moved to the south and the east, and those states had larger share of the cases. Next slide. So this is a sample of the dashboard that we prepared that is updated every day, and I'm showing you the data from yesterday, and that's the advantage of having the app, so that you can show very fresh data in your app without asking your graduate students. And so typically what's happening in India, 80,000 cases. At one point of time, it was about 97,000. It has come down, about 1,000 deaths. But the rate of growth has slowed down, and you can see that the R for the first time has gone below 1 in the last 190 days, over the last 2 weeks. Next slide. So moving forward, I think that what India should do in terms of policy, these periodic serosurveys to give us an idea that how far we are from this notion of herd immunity should be done. And also, I think the centralized isolation and quarantine, Indian households are very difficult to practice self-isolation. So centralized isolation and quarantine facilities is key. I also think that the people who are recovering from COVID, there should be a national follow-up cohort of recovered patients. And I think the use of data, nimble policy making, because we have to get to this long-term mode of pause, push, and drive. This is a long game. This is not a short headline management type tactics, which they are not going to work. This is really a long haul. And so, and I really want to see historic data. It's very difficult to get data out of India, and we have raised a lot of voice about data accuracy and data release. If you have historic excess death data from Delhi death and hospital admissions, we'll have a better idea about the pulse of this pandemic. Next slide. So I think that the humanity, I'd like to end with, and I know I'm running out of time, I just want to end with the humanitarian component. We are data scientists, but this time has really emphasized and ingrained in me as a human being that there is a much bigger aspect to it, which we are underplaying. Next slide. So this is a slide about, it's an old paper actually about the history of a Spanish flu in India. So India was really hit hard by the Spanish flu in 1918, and there were about 12 to 19 million deaths according to various historians. 5% of India's population died. But you can see something striking about these virus curves, which is taken from a very old paper. You can see that the sort of footprint and the signature of the virus was very similar even 100 years ago. It first hit Mumbai. It was called Bombay fever. And you can see the peak. And then as we moved through time, different states came to boiling point at different times. And then by the time it got to Calcutta, that's the more muted curve on this graph. And it exactly shows the same pattern. Next slide, please. And these are some guidelines for, Spanish flu, and that was published in 1920. And you can see that there are some guidelines which are eternal, one of them being, do not disregard the advice of a specialist just because you do not understand. So this has resonated with me, and I think that these are like, the interventions that we are talking about, the human behaviors we are encouraging are very similar even in 100 years. And also I think we really need to emphasize that it is a long haul. We are tired, but we have to adhere to we have to manage and mitigate our risks every day. And the mental health toll and the humanitarian aspects need to be talked about more. And we are focusing on COVID, but we can see in the University Hospital in Michigan that due to delay in care, morbidity and mortality are rising from other cases as well. Next slide. So this paper really resonated with me. If you have a chance, please do take a look in Nature Cancer on being human in the face of a pandemic. Next slide. India is a very poor country. So here on this slide, I'm showing you Dharavi, one of the largest slums in India. But you can see that every woman there has a face covering, and the ASHA health workers and the community health workers are tracking. We cannot do so many tests for everybody living in the slum, but they're doing temperature checking, monitoring, and this has been a huge success story of how to adopt public health prevention in a low resource setting where we are not blessed with lots of tests and lots of proper face masks. But the human behavior, the effort to try can still be carried out. Next slide. In my own state, West Bengal, there is a very big cyclone. So in the middle of a natural disaster, how do you do social distancing? So you have to think about whether you are going to save lives, livelihoods, how do you survive in this very difficult, challenging times. Next slide. And again, there is a plane crash in Kerala. So what I'm trying to say is that all of these things are happening. Next slide. But I'd like to quote a poem by Austrian poet Rilke, and that is relevant to all of us. And you can see this, a man in India amidst cyclone walking and not giving up. So the last quote, this also appeared in the film Jojo Rabbit, let everything happen to you, the beauty and the terror, just keep going because no feeling is final. We are in the middle of a low point, but given history, we know that happiness and hope are around the corner. And then again, when we are going to be very happy and complacent, then we'll know that there is sadness looking at us. So we'll like to end on a philosophical note. Next slide. And I just want to say that it has been 2020 has been a spring quartet, and this is an antique cartoon from 1920. It has been a spring quartet between the government, the public, the scientists, and the virus, and it has not always been in harmony, but we are still playing. The next slide, the last slide, is that why do I do this? And many people have asked me, why don't I work on the Michigan data? And US has a bigger problem than India. But this is my desk in Michigan, and my parents, and unicorn, and family is important. And sometimes your work has to relate back to who you are. And as I said, that I look forward to going back to India very soon. Thank you very much for your attention, and I really, really apologize for all the technical difficulties that we have had. Please stay safe.
Thanks, Bhramar. It's a really very interesting talk. Especially, I learned quite a bit about it. I didn't know so much what's happening. Fabia had to leave because she had a meeting at 1 o'clock, so I'm taking over. So basically this brings close to the station, and basically if you people need slides of the talk, we'll try to get from the speakers if they are willing to share with us, and we'll try to put on our website.
Absolutely.
Since there's no time for questions, we are already running more than 25 minutes late. This brings the research part of our conference to a closure. COVID-19 being a real hot issue right now, we at the Center for Data Science planned this workshop within a very short time because we felt that development of vaccine, prediction of what future may hold, especially if COVID was left unchecked, and therefore control of the spread of COVID-19 being so data dependent, and also with all the controversies, contradictions, and unfortunately with science being under attack and under the threat of being compromised, it was important that we provide a forum for discussion from the data analytic point of view. So that was our intent. This is all the more important now, as we just learned today, this morning, that even our president and his family has tested positive for COVID. Okay. And we shall see how his viewpoints change due to this personal unfortunate event for him. Hopefully, science will have more support from politicians. Clearly, having organized this conference within a short duration, we needed to be a bit selective, yet still comprehensive in terms of research issues being investigated. That's why it was a short conference, this one day. We'll plan similar conferences hopefully in future, maybe longer. I hope that we were able to do that, in a meaningful way, and I sincerely hope that you were able to provide a forum which was informative. So let's thank all the speakers for taking time to present to us their scientific research and their evaluations, to the panel participants, and to my colleagues Fabia and Randy for chairing the sessions. They are the founding members of our Center for Data Science, and of course to Vijayan for opening remarks. We plan to organize more of such events in future, covering the data analytics in other disciplines. So please do visit our website, for the Center for Data Science, for more information. I, being an applied statistician, hold these events, these activities where data analytics plays a pivotal role in public policy, very close to my heart. So tomorrow, we have a 3-hour-long virtual workshop on getting started with SAS, a point-and-click approach, by Dr. James Haroon of SAS Institute. Since SAS is the most popular statistical software used by researchers in a large number of disciplines, and especially when for FDA and for NIH, SAS is the gold standard for their data analysis. And I can tell you SAS is a very good software because I've written 2 books based on SAS. Okay. So I would recommend to anyone remotely interested in data analytics to attend, just to learn the basic functions and get started. Even if you are not planning to do the data analysis of your own data, okay, but at least you will be able to understand if you know a little bit of SAS. So clearly, being a point-and-click approach, it needs no coding knowledge and no major technical expertise, so it should be easy for everyone and anyone to really get something out of it. So please do consider attending. So again, thank you for attending the conference. I hope you enjoyed it as much as I did. Thank you again.
Thank you, Willie. And I also want to thank Xander for helping us kind of coordinate the event and take care of some of the technical issues. Thank you, Xander, and your team. Greatly appreciate your help. And thank you.
We did have. So yes.
Right. Yeah, thanks to all the participants for sticking with us, and hopefully you got something useful. And like Ravi said, please do check our website and maybe participate in our future events. And so thanks to all the presenters and the panelists and the participants. Thank you. Yeah. Bye.
Have a good day.
Bye, everybody. Have a nice day.
Yep. Bye-bye.
All right. See you, everyone. I'm going to close it out, and I'll get those recordings over to you, DJ, next week sometime.